So today's topic of discussion was of abnormal uterine bleeding and uterine hyperplasia. So first we'll be discussing the abnormal uterine bleeding. So what basically abnormal uterine bleeding in what importance it is having? It's the basic common complaint in gynecology and family practice. It affects 1/3 of the women at some stage in their life, and the management includes establishing the cause of it and instituting an appropriate therapy. Before going to abnormal uterine bleeding, we first must know what the normal uterine bleeding is. Usually, in reproductive aged women from menarche to menopause, the frequency of the menstrual cycle is from 21 days to 35 days interval, and the duration of it is normally in between 2 to 8 days, usually 4 to 6 days. And the flow average is about 35 ml, although 10 to 80 ml is considered normal. One normally soaked regular pad or tampon holds about 5 ml of blood. However, depending on the brand of the pad or tampon, a pad can hold from between 5 to 15 ml of blood. Menarche usually occurs around 9 to 16 years of age, mean being 12 or 8, usually 2 to 3 years after the first sign of breast development. And in reproductive years, the cycle length is of usually 23 to 39 days, mean being 30 days. And duration of the menstrual bleed is for average 5 days. Being and normal blood loss between 10 to 55 ml. Menopause usually occurs between 48 to 55 years. Mean is 51 years, but nowadays in Indian scenario, they say that the menopause occurs at around 46 years of age. And we all know about menstrual cycle. That is which includes the ovarian cycle and the uterine cycle. The ovarian cycle includes the follicular phase, the ovulation, and the luteal phase, while the uterine cycle includes the proliferative and the secretory phase according to the ovarian cycle, followed by the menses. These are the hormonal changes that occurs during the menstrual cycle. We have already discussed this in previous lectures. Now, what is abnormal uterine bleeding? It is one of the most common health concern of the woman and can present in many ways, from infrequent episodes, that is known as oligomenorrhea previously, to excessive flow, that is the heavy menstrual bleeding, or prolonged duration of the menses or intermenstrual bleeding. And in this lecture, we'll be focusing only on the heavy menstrual bleeding. Now, mean duration, as we discussed, is around 28 plus minus 7 days. Average menstrual blood loss is around 35 ml, a range being 10 to 80 ml. And average number of days of menses is around 4 days, normal range being 2 to 7 or 2 to 8 days. Bleeding is abnormal or heavy if it occurs at an interval of 21 or less days or 35 days or more days, lasts longer than 7 days, or the minimum blood loss of 80 ml or greater is there. The term dysfunctional uterine bleeding is no longer now favored and should be discarded. So we have not to discuss the case as a dysfunctional uterine bleeding, but rather as an abnormal uterine bleeding. This was an abnormal uterine bleeding. The older classification, it was including the terminology like dysfunctional uterine bleeding. Uterine bleeding was the diagnosis of exclusion in that case, and menorrhagia was known as heavy menstrual bleeding, that is more than 80 ml. Metrorrhagia was bleeding in between the periods or the irregular intervals, excessive flow and duration. Polymenorrhea, we used to say when the bleeding occurs more often than every 21 days. Oligomenorrhea was said when the interval was longer than every 35 days. Also, amenorrhea, this now is used, no menstruation. It could be primary if no menses occurs up till the age of 16 years, and secondary if there was no menses for at least 3 months after menarche has occurred, then it is known as secondary amenorrhea. Oligomenorrhea, normal menstrual duration and intensity, but decreased frequency, and the length of the cycle could be more than 39 days. Usually, it is associated with anovulation. Postmenopausal bleeding, vaginal bleeding in a woman who has reached menopause age or had 6 months of amenorrhea preceding the episode of vaginal bleeding. However, we should note that the menopause is said for if the bleeding does not occur for 1 month. So all these definitions, that is the polymenorrhea, menorrhagia, metrorrhagia, all these dysfunctional uterine bleeding, these are not used nowadays. What is the difference between abnormal uterine bleeding and the dysfunctional uterine bleeding? Prior to definitions, the prior definition, that is the dysfunctional uterine bleeding, had some gray area, but unlike AUB, DUB was a diagnosis of exclusion for which no cause was identifiable. When no cause was identified, then the bleeding was said to be dysfunctional uterine bleeding. Now, what happened is, FIGO in 2011 eliminated the misleading term of this, and articles also unanimously recommended that we should discontinue the use of term dysfunctional uterine bleeding. And now the term that is used is abnormal uterine bleeding, that has now been classified by FIGO as a palm point classification. This palm point classification classifies by bleeding pattern and etiology, and then it was introduced by FIGO in 2011 to create universal nomenclature system to describe uterine bleeding abnormalities in reproductive aged women. And ACOG also supported adapting the palm coin classification or nomenclature to standardize the terminology used to describe the abnormal uterine bleeding. And this is one of the publication that discussed the FIGO classification of the causes of abnormal uterine bleeding. Abnormal uterine bleeding could be in term of quantity, or it could be in term of regularity, or it could be in term of time. That is, either it is less in amount, more in amount, whether it is occurring regular or irregular, or whether it is occurring for long duration or short duration. Acute abnormal uterine bleeding, where the episode of heavy bleeding is sufficient, is in such amount that it requires immediate intervention to prevent the blood loss. Chronic abnormal uterine bleeding is when present for most of the previous 6 months. And acute one is that which can be spontaneous or in context with the chronic abnormal uterine bleeding. Intermenstrual bleeding that occurs in between the menstrual cycles. Heavy menstrual bleeding, that is excessive menstrual blood loss which affects the quality of life, which could be physical, emotional, social, or material. The objective definition of it is blood loss more than 80 ml per cycle, and 60% of these women will have an evidence of iron deficiency anemia. Subjective heavy menstrual bleeding, in those cases 50% of the women presents with heavy menstrual bleeding and will have measured blood loss within the normal limits, but must still be considered abnormal and investigated accordingly.